Hello, I'm Dr. James Bogash, Master of Health and Longevity and creator of Modern Health Mess, as well as the owner of Lifesteer Chiropractic. And as a practicing chiropractor for 22 years now, this particular video is going to be a wee bit biased, but it has to do with a recent study on chiropractic care and opioid use. This is not the first time that we've seen that chiropractic care is essentially the antithesis to the opioid crisis. Despite that, we remain somewhat of the red-headed stepchild when it comes to this problem. We talk a lot about treatment, we talk a lot about destigmatizing, but we don't talk about prevention. And chiropractic care plays a massive role in prevention. I remember this one was not published, but I happen to know some people at Optum Healthcare, which runs United Healthcare, the chiropractic and physical medicine benefit, and they found not only did current users of chiropractic care have a lower opioid use, but a decade later, 10 years later, those patients who saw a chiropractor for a complaint had less opioid usage a decade later. That's pretty substantial. And so the results of this particular study should not come as a big surprise. It just is yet another research article supporting the use of chiropractic care in preventing just all medications, but specifically pain management medications like opioids. In this particular study of over 100,000 patients, this isn't a small study, this is a big study. So to be exact, 101,121 patients in New Hampshire and Connecticut area. And these basically patients were assigned, they either saw a primary care doctor only or a primary care doctor and a chiropractor. And the group that saw the chiropractor had, interestingly enough, there was a difference between the states, but in Connecticut, those patients that also saw a chiropractor were 55% less likely to receive a prescription opioid, and those in New Hampshire were a pretty respectable 203% less likely. The reality is that despite all of the... Keep in mind that we've forgotten that there's an opioid crisis because of the pandemic. And so while we're all focused here, in the background, substance use disorders have been increasing in an alarming way, opioid use at the top of them. I know I've been relatively busy. We have patients, people working from home on poorly designed workstations, and they're hurting more than ever. They're less active. All kinds of bad reasons why this may be happening. But so it makes sense that chiropractic care would be a solution. And despite that, it's not looked at as a solution from the sky-high national level, which is quite frankly a travesty, considering that all of the research consistently talks about or finds that there's less prescription drug use, including opioids, when chiropractors are involved in the care. And this is the average chiropractor. This isn't, I have a personal bias. I think that if more of my colleagues worked soft tissue, we'd rule the world of physical medicine. And so our office generally, my bias is that we do a much more thorough job because we're also addressing the soft tissues. But these studies and these outcomes are from the average chiropractic office. So what does that say about, in general, how effective chiropractic care can be? As I mentioned, I do happen to have a particular bias in this, and I just want to let you know that on the front end and the back end. As always, I'll post a link to this particular study in the comment section. Make sure you share this video with somebody who you think needs the information, subscribe to the channel, and make sure you like this video as well.